This is the QTV Nightly News coming to you from our studio on Caraba Avenue, and I am Andy Kema. Thanks for joining us. Here are the headlines. In his update on the progress of the ongoing census, the Gambia Statistician General says 29.5% of the targeted households and 27.1% of the total population have so far been counted. A delegation from Global Funds has arrived in the Gambia ahead of the launch of a major multi-million-dollar grant for the Gambia's health sector. The last batch of Gambian pilgrims left for Mecca on Wednesday night for this year's Hajj. At the opening of the recent Smart Advocacy Forum, the UNFPA country representative called for increased domestic financing for quality-assured reproductive and family planning products. In business news, Opticalia, a leading eye care clinic, opened an ophthalmology clinic in Banjul. Those were the headlines, now the news in detail. If you're just tuning in, this is QTV News and I am Andy Kema. In a census enumeration press briefing on Thursday, the Gambia Statistician General told journalists that so far 91,783, constituting 29.5% of the targeted households, were enumerated, while 768,876 people, constituting 27.1% of the total population, have so far been counted. Julian Jai reports.
The objective of the 2024 census is to provide statistics on demographic, social and economic characteristics of the population, household and housing characteristics. This helps central and local governments to plan various social services such as education, health, housing, sanitation and others. Nyakasi MB Sanyang, the Statistician General, updates the media on the progress made so far.
We are pleased to announce that as of yesterday, the fifth day of the enumeration, 91,783 households, constituting 29.5% of the targeted households, were covered or enumerated, while 768,876 persons, constituting 27.1% of the targeted population, were enumerated.
SD Sanyang says half of the local government areas counted are above target.
Basse, Kuntao, Brikama and Kerewan exceeded the target, with Basse enumerating 15% above target. Mansakonko has the lowest coverage with 32.5%, followed by Banjul, Kanifing and Janjambri. On average, I am pleased to inform you that we have enumerated 40%, which is slightly above the national target of 37.5%. In short, I wish to inform you that the process is on target and hopefully we will finish as expected.
Mr. Sanyang explains the impact the late deployment of the field workers has had on their work.
Due to the late deployment of the field workers, some are concurrently listing and at the same time enumerating. The delay experience was mainly due to the factors mentioned in the last press conference. In the cases where applicants have to be moved from one area to the other, and other applicants removed from the classrooms. This affected the process and really has some negative impact on our progress.
The Statistician General also highlights some of the challenges facing field workers.
They are experiencing refusals in certain parts of the certain areas in KMC and West Coast region. Certain households are not cooperating. We continue to encourage the general public to give the field workers the maximum cooperation to get everybody, both citizens and non-citizens in the country, enumerated. This is a very important exercise, and everyone in this country required to be enumerated.
Mr. Sanyang urged the field workers to stay committed to the national exercise to be part of the success story of the country's first digital census. He also calls on the public to call their hotline 1242 for any enquiries from any GSM operator. For QTV News, I am Juldeyai.
A delegation from Global Fund has arrived in the Gambia ahead of the launch of a major multi-million-dollar grant for the Gambia's health sector, a significant step in Global Fund's partnership in the Gambia in the fight against malaria, tuberculosis and HIV/AIDS. Momodu Laminchoy reports.
The Global Fund delegation arrived in the Gambia on Wednesday and were received by Ministry of Health officials at the Banjul International Airport. Adafai, the Chief Financial Officer of Global Fund, and Kadisal Sow, the Department Head of Global Fund Africa and Middle East, respectively, thanked the Ministry of Health for the warm reception and explained their visit to the Gambia.
We're here to launch our grants for the next 3 years. And for those of you who don't know, the Global Fund is a fund that provides grants to countries mostly in Africa to fight HIV, TB and malaria. The partnership with the Republic of the Gambia has been going for the past 20 years. And this is a very important milestone because it is the first time we are starting to relaunch grants post-pandemic, and we all know the impact of COVID and health in the economy of the people.
We know that Gambia is the land of smiling people, so we've come and found the warmth of Gambians. We've been working with the teams here, not only in Ministry of Health, but also civil society organizations for the last 2 decades. And we're hoping that the partnership over the next 3 years is going to deliver even more impact than it has in the past.
Gambia's partnership with Global Fund has existed for 2 decades, during which the International Funding Organization has made significant investment in Gambia's health sector. Adafai and Dr. Omar Jad Jr., Chief Financial Officer of Global Fund and Permanent Secretary of the Ministry of Health, respectively, underscored the results of the Global Fund Gambia partnership.
What we could tell you is that over the last 20 years, the Global Fund and the government of the Gambia, the partnership, we have invested over $200 million in the health sector. And it has gone a long way in improving the health and livelihood of Gambians, especially in malaria.
And what we want to show is that as a government, we really appreciate the work and the collaboration that we have been having with Global Fund. A lot of support have been trickling, and of course, especially when you see the impact on the grassroots in the Gambia in terms of health, our healthcare system. Everything that you see today in terms of development, so that definitely there have been very much the hands of Global Funds there.
The Gambia's health sector is being transformed with support from development partners like Global Fund. With the launching of a new grant in the Gambia, Global Fund is set to partner and support the government in its effort to tackle the health challenges facing the country. Momodu Laminchoy, QTV News.
The last batch of Gambian pilgrims left for Mecca on Wednesday for this year's Hajj. As they embarked on this important journey, the intending pilgrims promised to pray for the peace and stability of the Gambia while fulfilling one of their religious obligations. Momodu Laminchoy again.
This is the last batch of hundreds of pilgrims from the Gambia, setting off on the journey of a lifetime after completing all the travel protocols and requirements. At the airport terminal, they anxiously and excitedly wait to board their flight. For the intending pilgrims, such a rare opportunity is an answer to divine calling in fulfillment of one of the 5 pillars of Islam.
I feel honored to the Almighty because it's a great opportunity. It's once in your lifetime, and we pray for the country also. And then we pray that Almighty Allah grant us what we wish for when we get there. And then bless this country to keep maintaining peace and tranquility in the country. We are grateful.
Overwhelmed, very overwhelmed. And I thank Allah subhanahu wa ta'ala for giving us the opportunity to see Kaaba and the Rawda of UNFPA sallallahu alayhi wa sallam.
While the intending pilgrims wait for the departure, the Minister of Religious Affairs, Hamad Nkeba, officials of the Gambia National Hajj Commission, and the President of the Supreme Islamic Council, Alhaji Esa Dabo, briefed them.
On behalf of the National Hajj Commission and the Gambia Supreme Islamic Council, it is a tradition before departing for pilgrimage that we pray for you to accomplish the mission and return home safely. You are going on a mission of Allah. In the process, pray for the country, the President, and every Muslim.
On behalf of the President, the government of the Gambia, and of the people of the Gambia, wish them well and to appreciate them, the level of discipline they have manifested, and also to thank all those who have contributed to the successful lifting of all our pilgrims on schedule and on time to the Holy Kingdom of Saudi Arabia. And this, we thank all government institutions and individuals and private operators, travel agents, everybody for that matter, including the civil aviation.
Apart from performing the Hajj, the intending pilgrims are going to Mecca with wishes to pray for their family, loved ones, and the country. The last flight was scheduled to depart to Medina before 10 p.m. Millions of pilgrims will visit and perform their Hajj in Mecca, Islam's most sacred place of worship. The Islamic pilgrimage is performed at the Holy Mosque of Masjid al-Haram in Mecca, Saudi Arabia. Muslims are obliged to perform Hajj at least once in their lifetime, so long as they can afford it. This year's pilgrimage is from the 14th to the 19th of June. Mahmoud Lamin, Choy QTV News.
We will now go for a commercial break. When we return, we have more local and business news stories. Do stay tuned.
The future is now with QCell's 5G network. Experience speeds like never before with our new 5G Rocket Fixed Internet plan. Get speeds from 10 Mbps to 100 Mbps. Your 5G-enabled devices. Walk into QCell headquarters to get one of our 5G routers and experience the true feeling of 5G. Only with QCell. QCell brings you the future. Tech, innovation, incredible speed. The future is now. For more information, call our customer care on 111. QCell, Sunyapus. We innovate, others follow. Terms and conditions apply.
The art of juggling is a true spectacle of agility, coordination, and speed. A symbol of progression, precision, and mastery. "5G speed is like having the juggler in your pocket. With lightning-fast download and upload speeds, you'll easily be able to juggle even the busiest workdays. Whether you're a busy entrepreneur, a creative, or just someone who wants to stay connected. Juggle your tasks with ease with QCell 5G speed. The future is here. It's fast, reliable, and efficient. First brought to you by QCell. We innovate, others follow.
Welcome back, and this is QTV News. At the opening of the recent Smart Advocacy Forum, the UNFPA country representative, Dey Rosar, called for increased domestic financing for quality-assured reproductive and family planning products. Ansumane Sonyasi was at the event, and he now reports.
As the UNFPA spearheads the advocacy and mobilization of resources for the attainment of the universal access to sexual and reproductive health in the Gambia by 2030, stakeholders gathered to deliberate on the importance of country contributions and strategize to help achieve the 2030 target by leveraging on domestic instruments such as the National Health Policy. And as the UN urges respective states to complement funding for reproductive health commodities, Ndero Sar, the UNFPA country representative, says this will empower women and help lessen maternal mortality, amongst others.
We are lucky to be in a country where the government strongly believes in the issue of family planning and women's empowerment and gender equality. The National Recovery-Focused National Development Plan clearly stipulates the issue of demographic dividend, and we all know that to achieve that, you need instruments like family planning. Moreover, we also know that family planning is one way of empowering women by giving them the power to decide over their reproductive health choices.
Matthew Cummings of the UNFPA's West and Central Africa Regional Office calls on government and other stakeholders to collaborate to help address sexual and reproductive health challenges affecting women and girls in the country.
We also recognize that most of the unplanned pregnancies are taking place among the poorest households. And so if we can ensure universal access, we can make a dramatic impact on reducing poverty and income inequality across the country.
Babaning Sabali, Deputy Permanent Secretary at the Ministry of Health, says government acknowledges the need to work with partners such as the UNFPA, hence the institution of domestic instruments that highlights the need for partnerships that ensures the delivery of quality health services. Mr. Sabali also highlighted UNFPA's support to the Gambia's health sector, particularly the National Reproductive Health Drive.
The team for National Health Policy 2021-2030 calls for partnership, building partnership for quality health care delivery. Therefore, we want to ensure that we nurture and strengthen this partnership, and we are looking forward to other partnerships that will contribute to quality health delivery system in this country.
The UNFPA's smart advocacy approach seeks to influence domestic investment in family planning by engaging and building the capacity of key actors, particularly state agencies. And as they look forward to building strong partnerships, it is hoped that such engagements will help facilitate the attainment of the 2030 agenda that seeks to make universal access to sexual and reproductive health care services a reality for women and girls. Ansumane Sonyasi for KTV News.
The Medical Research Council Unit, the Gambia, at the London School of Hygiene and Tropical Medicine, in collaboration with Imperial College London, commenced a 5-day workshop in Banjul on digital diagnostics for African health systems. Julian Jai reports.
The workshop is funded by the Research England International Science Partnership Fund 2023-2024 Global Development Hub ODA Project Accelerator, which focuses on engaging key stakeholders and patient representatives in co-developing digital diagnostics and enhanced intra- and inter-WP collaborations and cross-country sharing of protocols, imagining findings and plans for ongoing work. Professor Aubrey Cunnington, the co-lead of the NIHR Global Health Research Group on Digital Diagnostics for African Health Systems, explained the rationale behind the workshop.
There's a massive need for diagnostic tests in Africa. It's really alarming to read reports from the World Bank and other organisations which have done surveys that show that more than 50% of the population in Africa don't have access to diagnostic tests at all. And even those that do often don't have access to the essential diagnostic tests that are recommended by WHO. And if we don't have diagnostic tests, we don't know what is causing someone's illness. And then we don't know what's the best treatment to give them. So it's almost like the nurses and doctors wearing a blindfold when they're trying to work out what's wrong with their patient.
Professor Umberto D'Alessandro, the MRC's unit director, says they have been working on the cause of infectious disease for the past 3 years. Professor Umberto went on to say that their mission is to provide tools to the Ministry of Health and other countries to combat diseases.
We have tried to create the prototypes to diagnose malaria infection, but we can use the same system. We can change some of the parameters in the test to also diagnose other pathogens.
Dr. Mustafa Bitey, the Chief Medical Director at the Edward Francis Small Teaching Hospital, spoke of the impact of the research project.
We look forward to it being successful so that we can also benefit from it. And that is my people in Charmen. We'll just do the test there and get the result. They don't have to go to SL or Banjul.
Dr. Bitey highlighted some of the impact of the MRC government partnership.
What we want and what we are working with them is also to help develop local talent. So that's why we're encouraging always our young scientists to work with them and get the expertise so that they can also be independent researchers. So, and we are able to count a few now that have worked with them, get the PhD. We hope very soon we'll also have very independent researchers who can have grants, win grants.
Levia Kaduni Bawa is a PhD student at the University of Ghana.
Research is being spearheaded by the students. It's been divided into 6 different work packages that focus on different aspects of diagnostic developments. And that includes the development of the device, the evaluation of it clinically, trying to look at user interface, trying to look at health systems management, and then engaging with stakeholders.
The event will present a unique opportunity for stakeholders to engage with each other and the NIHR DIDAHS team to co-develop digital diagnostics that meet the needs of African healthcare systems. The Digital Diagnostics for Africa network was set up in 2020. The network is an international and interdisciplinary community of experts with a strong interest in developing innovative digital diagnostics approaches to tackle diseases that primarily affect the African continent. For QTV News, I am Julde.
Next up, we have some business news. Opticalia, a leading eye care clinic providing a range of services including eye exams, glasses and contact lens fittings, amongst other things, opened an ophthalmology clinic in Banjul on Wednesday. Lolly M. Kamara attended and filed this report.
According to the World Health Organization, approximately 20% of the Gambian population suffers from some form of eye disease. The most common eye diseases in the Gambia are cataracts, glaucoma and trachoma, which can all lead to vision loss if left untreated. Lack of access to proper health care and inadequate resources contribute to the high prevalence of eye diseases in the Gambia. Opticalia is known for its treatment of various eye conditions with a team of experienced optometrists and ophthalmologists dedicated to providing top-quality care and personalized solutions for each patient. With multiple locations and modern technology, they strive to make eye care accessible and convenient for everyone who needs it. This new store features a wide selection of stylish and affordable eyewear options for customers of all ages. The country director of Opticalia, Beatrice Camacho, shared her excitement about the new store and its potential to serve the community.
This clinic is not just another addition to our portfolio. It represents our first venture into ocular surgery, specifically cataract surgery. Until now, our focus has been on diagnostics and the sale of glasses and hearing aids.
Ambassador Issa Bokarsi, the Deputy CEO of the OIC Secretariat, is glad to be part of this history. Dr. Winston Sise, the CEO of the Sheikh Zayed Eye Care Hospital, recognizes the invaluable contribution of Opticalia to our healthcare system delivery since its inception in 2021. He also calls for more public-private collaboration in the healthcare sector.
The Ministry of Health, through the National Eye Health Program, is gearing up to handle the issues of visual impairment in its Sustainable Development Goals, and hopes to reduce the prevalence of blindness due to uncorrected refractive errors, cataract, and glaucoma in the coming years. We need the active involvement and services of private enterprises in the health sector also. It is here that clinics like Medicalia, Opticalia play a very important role.
Usainu Senghor, the CEO of Gambia Investment and Export Promotion Agency, GAIPA, spoke about the role of GAIPA in supporting businesses such as this one. Raul Dos Santos, General Manager of Opticalia, while acknowledging all those who contributed to this great milestone, and also announced the launch of the Opticalia Foundation.
Our foundation will initially focus on 2 main areas. First, we will stop charging parents for visual exams for their children up to 18 years old. We will commit to donating a pair of glasses to a school-aged child for every non-promotional pair sold in our Opticalia stores.
With its modern and inviting atmosphere, competitive prices, and commitment to customer satisfaction, Opticalia is sure to become a popular destination for eyewear in Banjul. For QTV News, Lolly M. Kamara.
Before we end, here's a recap of the headlines. In his update on the progress of the ongoing census, the Gambia Statistician General says 29.5% of the targeted households and 27.1% of the total population have so far been counted. A delegation from Global Fund has arrived in the Gambia ahead of the launch of a major multi-million-dollar grant for the Gambia's health sector. The last batch of Gambian pilgrims left for Mecca on Wednesday night for this year's Hajj. At the opening of the recent Smart Advocacy Forum, the UNFPA country representative called for increased domestic financing for quality-assured reproductive and family planning products. In business news, Opticalia leading eye care clinic opened an ophthalmology clinic in Banjul on Wednesday. That's all we have for you in this bulletin. Join us at 10 p.m. for another news bulletin.